Thanks for joining us on our YouTube channel. Before you watch this video on the 3 things that new grads have problems with coming out of PT school, get to the subscribe button, click that, and make sure that you get notifications on all of our YouTube videos when they drop. So let's get started on the 3 things that new grads complain about the most and feel like they're deficient with the most when they hit the clinic post-graduation. Number 1, time management. They have a hard time, especially with evals, getting through those evals, doing a good job, getting results, educating patients, getting to the right therapeutic exercise in the amount of time that they have allotted. What if I told you that new grads should be able to get through an eval, patient education, treatment, exercise progression in less than 45 minutes? Somewhere between 35 and 45 minutes. Get through all that stuff, great job. Patient gets up and says, I feel fantastic. I can do things that I couldn't do a little bit ago. Thank you. That's what you should be able to do. You're not able to do that when you do PT school because PT school did not teach you how to do that. They taught you the basics of the science. They taught you how to pass tests. They taught you how to pass boards, which has absolutely nothing to do, unfortunately, with what you are going to see in the clinic. And that's why you get behind on your schedule. That's why you lag behind if you've got a half an hour to treat patients. You don't think you can get that done. A half an hour to treat patients is more than enough time to get through everything that you need to get through. Number 2 biggest complaint is figuring out how to go from evaluation to treatment. So here's the problem. PT school, once again, did not teach you how to do that. They taught you how to do subjective, and then they taught you how to do an evaluation, and then they gave you some ideas on how to do treatment, and then when you got into your clinical rotations, you got more ingrained into those treatments, and then therapeutic exercise, kind of see where you're going. So the big gap is between evaluation and treatment. What if you had a systematic thought process that took you from subjective, directed you right to the evaluation so you knew exactly what you're looking for? The evaluation did not use special tests, did not worry about pain scale rating, did not worry about passive range of motion, did not worry about swelling, because it focuses on a functional screen. So if you go from subjective, that tells you where you should go and what you should be looking for on a functional screen, that goes directly into the treatment. If you're evaluating symptoms with a symptom-based thought process, now your treatment can only go towards symptom modification, decreasing symptoms, swelling, pain, passive range of motion, tight muscles. None of those things are the reason why your patient's coming to see you, even though they think that's the reason. But you're the doctor, you're the expert, you know better than that. You know that they're coming to you because of functional limitations that are secondary to neurophysiological conditions that you should be addressing. So if you are evaluating the correct thing, that leads you directly into the treatment, which leads you directly into the prescription exercise, prescription and home exercise program. And throughout that entire time, there's your patient education. You should be educating your patient as you go along as to what you're doing as far as biomechanics go, as far as neurophysiology goes, as far as anatomy goes. You should not be worried about symptoms. And that's where PT school leaves you lagging, and odds of you learning that in your clinical rotations is little to none. And last, the third thing that new PT student graduates complain about is lack of education as far as how to prescribe the right exercises, how to progress exercises. So here, once again, we have our problem. If you didn't get the right information in the evaluation and your treatment was all symptom modification junk, what do you think your exercise is going to be? It's probably going to be falling back on the 5 best exercises for knee pain, the 4 best exercises for shoulder pain, the 3 best stretches for runners. That is all garbage. There's no protocol, there's no magic exercise. If you have a thought process that got you through those first steps, it gets you right into the exercise. You know exactly what muscles they had problems with. You know exactly where their neuromuscular inhibition was and what you need to prescribe so they keep the facilitation that you just worked on, which increases range of motion decreases pain, decreases swelling, and increases function so that when you do a functional screen after you do their exercises, they can do things on their functional screen at the end of the visit that they couldn't do before the visit, which proves to you that you are focused on function and not symptom modification. So if any of that stuff is mind-blowing or doesn't make any sense, that's because you went through a system that prepares you to get into another system. PT school does not prepare you to be an elite practitioner. It prepares you to pass your boards, be sufficient in the clinic, and that is it. So if you graduate and you take your boards and you're thrilled with yourself and you throw a party and think you got it made, you're wrong. The hard work starts the day after you pass your boards and the first day you walk in that clinic. Now it's time for you to get to work and figure out what really goes on in a clinic, what really goes on with your patients. Because if you're only going to use what you learned in PT school, you're going to be frustrated, you're going to be confused, and just like the majority of PTs, you're going to be fed up with PT sometime within the first 1 to 3 years. The way you avoid that is to get to one of our products. All of them are listed below. If you're a student now and you don't want to go through those frustrations, get in the mentorship now. I will walk you through all of that stuff on monthly Zoom calls, and you'll have a library of videos to look at so you are prepared when you hit your clinical rotations and when you graduate. If you're out in the clinic, you're already frustrated, you're having problems with those 3 things that I just talked about, you need to get in the MemberShift. That is a 5-month program that will change your career in 5 months with videos dripped directly to you and a 2.5-day lab with me and the other students learning how to apply biomechanics, neurophysiology, anatomy, physics, all of that stuff in the clinic so you don't succumb to the conventional medical model and just chase symptoms for the rest of your career. If you are a strength and conditioning coach, sports performance coach, personal trainer that deals with athletes coming off of injury, or you want to keep them away from getting injury, and you want to use our thought processes in your setting, you need to get to the Mostrability link below. And that is a 2-week course that will teach you the thought process that goes behind exercise and exercise prescription and exercise progression. I'm not going to give you magic exercises. I'm not going to show you the coolest exercises that you can find on Instagram. I'm going to teach you a thought process so you understand what goes into each individual exercise, what your clients or athletes are telling you when you do a functional screen with them, so you understand where to go, where to start the progression, where to go from that, and if they do fall apart, how to regress them. So there's 3 products that will keep you away from falling into the conventional mess that are all below. Get there, and also, if you didn't hit the subscribe button, get there now.